Here are the basics of what you need to know about the Drager Evita XL vent in the PACU. To power on the vent, plug it into power, oxygen and medical air, and then hit the power button on the back side of the vent. Then you need to put the vent in standby mode. Click standby, then hit the round button to confirm. Then touch alarm reset and confirm. Note that anytime you want to change or choose different settings, always select, change, confirm. If you don't hit confirm, the vent will revert back to the previous setting. The ventilator modes most often used in PACU are CMV, SIMV, and pressure support. CMV is where the doctor orders a set rate, tidal volume, and PEEP. And SIMV is similar to CMV, except that there's added pressure support to assist the patient when they breathe spontaneously. SIMV mode can be more comfortable for a patient waking up from sedation. To calculate the tidal volume for a patient, the goal is 6 to 8 milliliters per kilogram of body weight. For example, for a 150-pound patient, their weight divided by 2.2 is around 68 kilograms. 68 kilograms times 6 and 8 milliliters gives you the range from about 400 to 550 milliliters is what's appropriate for a target tidal volume for a 150-pound patient. A set tidal volume higher than 550 could cause barotrauma, and lower than 400 could mean hypoventilation. The last vent mode that you'll see most often is pressure support. This is the mode where the patient proves whether they can breathe independently from the vent in anticipation of extubation. The Vent Settings tab calls this CPAP/pressure support. If the doctor orders any other mode than these, call RT to come and make the adjustments for you. To choose a vent mode, click Ventilator Settings on the right side, choose the tab on the touch screen that corresponds with the vent setting that's ordered, and confirm the setting that you want, making changes to the specific settings within. Twist the confirm button to change the settings and push the confirm button when you're done. When you're ready to connect the patient, hit the start button on the right side of the vent, then touch the screen start and confirm. Other features of this vent that you may need to know are the alarm reset button, which is the yellow button at the top of the hard keys, the O2 suctioning button. This is before suctioning the patient. Choose O2 suctioning and confirm in order to hyperoxygenate your patient. This boosts the oxygen to 100% for 2 minutes. Alarm settings. These reset every time the vent is powered off. Our standard alarms are MV high of 20 and low of 3, airway pressure 50, VTI 2, and frequency or respiratory rate of 50. These alarms are less important to set if the patient won't be on the ventilator for long. However, if you don't set the alarms, the ventilator may alarm frequently and lead to alarm fatigue. To place the vent on standby, hit Start Standby, the hard button, Standby on the touch screen, and confirm. Then Alarm Reset and confirm. Common alarms that you'll hear are high PEEP, usually during suctioning or when the patient coughs. These will stop alarming when the ET tube clears and the patient stops coughing. Low pressure or patient disconnect. This means there's a disconnection somewhere between the patient and the ventilator. Things to check are, is the circuit connected everywhere? Is the ET tube coming out, or is the cuff leaking? Check for leaks and disconnections all along the circuit. If your patient appears to be struggling or unable to breathe comfortably with the vent, disconnect them and use an ambu bag on 15 liters of oxygen to ventilate. Place your vent on standby and call RT to troubleshoot the ventilator. When your patient has been discharged from the PACU, remove and discard all vent circuits and wipe the entire vent down with a purple wipe. Place a clean circuit on top of the vent and call RT at 13508 to set up the vent and run a pre-use check.